So morning again, everybody. Welcome to the new academic year. Can you please indicate if you're all hearing me?
Yes, we're hearing you, Dr. Brown.
Here. Thank you so much, Rashawn. Rashawn will be assisting me in the process. Thank you, Shanique, as we go through. Welcome again. It has been a very interesting year, very interesting semester for you all. You are going to be seen as the vice chancellor said, as a COVID pioneer. Will be joining us shortly as to give her welcome, but she has ward rounds, so she will not be staying for the entire time. So for the hour, I'll be going through with you as to what to expect for the new academic year. You have been given your timetable. We have sent it the timetable out through your class president. And as you would have known based on last semester, it is quite fluid. It's quite fluid. So you may have changes. And part of the reason is that a lot, you know about the spike in the COVID cases. And for year two, a lot of your lecturers are clinicians. And you have a number of them who are in Department of Medicine and Department of Microbiology, also Department of Surgery. So I'm gonna ask that you all be patient with us because some of them may not be able to attend at the time that is slotted in because of some emergency. So I'm just asking you all to be patient, all right? I'm gonna start the session and so I'm gonna share my screen. But as soon as Dr. Trotman comes on, or Sean, I'm gonna ask that you indicate to me when she comes in, then I will stop my presentation so that you can give her welcome. All right, Rashawn?
All right, no problem.
Thank you. So, can you all see my screen?
Yes, we're seeing it.
Okay. All right. So most of you basically know what I look like already. So we'll be going through a number of things. Sorry guys, we have year one here. Please forgive me. We'll be going through a number of things. We'll be looking at the foundation courses again. We still have the regulations to go through, progression for, criteria for moving forward, for withdrawing, the protocol for managing failure. We'll be looking at your academic program, what to do with your SSM essays that you wrote, and then we'll go into the immunization or the vaccination protocol that you will need for going into your third year, all right? So most of you will be familiar with this. It kind of got messed up last academic year. You survived first year, and looking at it, you would realize that you actually went through quite a number of courses, So you have completed your fundamentals of disease and treatment, embryology and histology, intro to med, locomotor system, the cell bio, the healthcare concept, basic heme, respiratory system, neuroscience 1. And you're also tested on the anatomy component of the cardiovascular system. And I will go back into the year 2 courses, all right? So we have somebody's mic is up. Can you please mute it? Thank you. Right, so we have completed all of this so far, guys. And for all of you who were successful in everything, I say congratulations. I know there are some persons who did their resit exams in August. Those have been marked and they have been sent over to exams, but the release of those results really is the responsibility of the examination section, all right? In case I was a bit might have been remiss of me, but I also want to welcome the DDS student. And before I go further, most of you would realize that there's no longer any WJC. With the move to online teaching, there's no longer any WJC, so we're all one. And the first year students that we have now will be the first in a long time that is not starting out as WJC. As you know, we no longer have a WJC. All right, so it's just one, which is a SMONA. Now for your second year, coming into your second year now, having built up your muscle in your first year, you now have these system-based courses that you're going to be looking at, with the exception of man, health, and environment. Most of the courses that you'll be doing or completing in your year two are system-based courses. So we have the cardiovascular system, and the course coordinator is Dr. Marilyn Wright Lawrence. You have digestive system, and your course coordinator is Dr. Roy Green. And you have the endocrine and skin system, and your course coordinator is Mr. Gardner. The health and environment, you have Dr. Scarlett. Your first semester of your second year, guys, is going to be rough. Just telling you from the beginning, the courses are very heavy. Courses are heavily weighted, right? So you have these 6 credit courses in cardiovascular system and digestive system. What we found, university did a study and they found that the students did not particularly like the online system, but it is what it is. We have found interestingly though that the students have done very well in their assessments. So we'll go into that a little bit later. But what I want you guys to be cognizant of is do not make the same mistake that some of you probably made in your first year.
I did. This semester I did try it.
Please mute your.
You can't hear the audio.
You cannot hear the. Thank you. Right. So as I was saying before, guys, please do not make the same mistake that some of you might have made last year. So I'm going to ask that you start studying. Somebody's mic is up. That you start studying from the very beginning, all right? And please try as far as possible to clear these courses. If you look on your timetable, you'll realize it's very cramped. And on your timetable, you'll also notice that endocrine basically starts in the last 6 weeks or the last 7 weeks. So that one is even more cramped. Please do not sacrifice it. Some students in the past have indicated that they will sacrifice endocrine and just focus on the other courses that are there. I'm going to ask you, please, please, please do not take that approach, but try as best as possible to get through, all right? Now, having completed your semester 1, and hopefully it will run according to schedule, you will not be getting 2-week Christmas break, but you will get in all of a month, because basically we'll not be coming back close to the end of January. You'll get a nice long break, nice long rest. And then now we look at the courses of neuroscience 2, which will be taught and assessed in semester 2, IMP 2, which will be partially assessed in semester 1, but then you have a 2-week rotation component. Can you give me 1 second, please? Thank you. That's not too short. My apologies, guys. Dr. Trotman will be with you shortly. She'll be with you shortly, all right? So where was I? So we're talking about neuroscience 2 in semester 2, and that will be assessed. It's a very heavy course. I think it's 9 credits. We have IMP, as I said before, and you'll have a dental rotation, a medicine rotation, and also a surgery rotation, all right? That's like 2 weeks. And this is normally done in the summer. Your renal and reproductive system, otherwise called UG, is basically 2 parts. So you will have 1 component that will be taught in semester 2, and that will be assessed. And then you'll have a second component that will start in your year 3, semester 1, and that will also be assessed. Because this is ongoing, I will go back over this again when you get into semester 2. Because this is ongoing, you will not be seeing your grade for UG at the end of semester 2, but instead you will be seeing your grade at the end of semester 1 of year 3. All right?
Dr. Brown, sorry to interrupt, but as host, could you just mute everyone? And Dr. Chapman Edwards just joined, by the way. She just came in.
Joined. Okay, so let me see if I can mute her. She is in the session.
You go over that and you're going to start dying.
Okay. Morning, Dr. T. I'm going to stop sharing so that, Dr. Trotman, I'm going to stop sharing so that you can address the group, okay?
Yes. Okay. Good morning, students. I'm so sorry. I went into the wrong Zoom link, and I was actually waiting and quite surprised why there were only 4 people. Hello, good morning. Are you all hearing?
Yes, we're hearing you, Dr. Edwards.
Yes. Okay, so I was just apologizing. Please mute your mic. Somebody's mic is open. Okay, I was just apologizing for coming in late. I actually went into the wrong Zoom link, and I was there waiting. And funnily enough, there were 3 other people inside that room. But I just like to take this opportunity to welcome you back in these unprecedented times of our pandemic. I hope that you all have gotten some sort of rest and rejuvenation. I hope that your first year went satisfactorily for all of you, and that you all are ready for this second year. As you know, because of what's happening around us due to COVID-19, we are unable to have face-to-face lectures with you for this semester. We are truly hoping by next semester, semester 2, which will be in January, we'll once again be able to welcome you on the Mona campus. However, I'd like to say that all of the faculty and the support staff, we are all here to continue to help make this experience on this journey that you have become to becoming a doctor, to make it a satisfying and a rewarding experience for all of you. I hope that for all of you, you and your family that you all have been safe, that you would continue to be safe. Please continue to obey all protocols in whichever island you are, but I know the protocols are more or less the same. Please remember social distancing. I must say, I'm not saying from your group, but I have seen medical students congregating in social encounters and not distancing, not having on their masks, right? I've seen some of them on the campus. I've had to stop and say, what is going on? Please put on your mask. Remember, although the data may show that for younger people, the outcome doesn't seem to be as severe as for the older, but we do have young people who have had unfortunate outcomes. So do not perceive yourself not to be at risk. So please, social distancing, washing of your hands, sanitizing, wearing your mask, right? As you know, in Jamaica and in Trinidad, we now have community spread, which means that you need to treat everyone as if they were COVID-19 positive, because you do not know. Remember, your health is your most important asset at this point in time, and you really do want to safeguard your health. Remember, as we have always said, in terms of your academics, you must always look for balance, right? And that balance means mental, physical, social, psychological, right? That balance. Although you are distant from us, remember that some of the services remain. So our services at the health center for counseling, etc., that remains in place. And you can virtually make contact with our counselors and psychologists, etc., at the health center for help that you may need. The Dean's office also remains here for you, and you can reach out to us via email or phone if you need any help. As we have always said, reach out early. If you are having problems, if you're having social problems, you know, family problems, anything that will impact upon your academics, please let us know beforehand. Don't wait until it's too late. Reach out to us. We will see how we can help you. Dr. Brown will go through your performances, etc., in your exams, but I'd like to wish you all the best for this new academic year. Thank you. All right, Dr. Brown.
Okay, thank you, Dr. Drummond. All right, thank you guys. So can you all see my screen, Rashawn, my assistant? Can you see the screen?
Yes, we're seeing the screen.
Thank you, Rashawn. So as we were saying, we were going through your semester 2 of year 1. I think that's where we reached. And at the end of May, you basically have about 5 weeks break or 6 weeks break. But the thing is, you start your year 3 in June. You start your year 3 in June. And this is very important, guys, and let me tell you why. If you complete your second year, your second semester exam of your second year in May, and you're going to be starting your year 3 in June, it then means that all of your resit examinations are going to be held in June, just before you start year 3. So what I'm trying to say here is that you really don't have much time. So I'm going to ask you to try as best as possible, try your very best to get through all of the exams, because it's very stressful when you're trying now to study. I think you probably have about 2 weeks in order to study, to do your resit exam in order to start your year 3, all right? So your year 3 will be in the summer. So you realize that no, you're not following the regular semester 1 and semester 2 system that the university has. Your system now is going to be totally different from basically everybody else on the campus. So you'll start your year 3 in June. You will complete it in about September, God's willing. And then after a 2-week break, you will go on to do your rotation in your junior clerkships, all right? But for now, what I want you guys to focus on basically are the courses that you will be doing in your year 2. Remember that all of these courses, both semester 1 and semester 2, are going to be held online. So as it relates to the anatomy, yes, I know it's a little bit weird and you encountered it for respiratory system. All of these anatomy labs are going to be online, and you realize that anatomy is very integral to a lot of the system-based courses. So your digestive system, you'll have an anatomy spotter, same thing for endocrine, same thing for neuroscience too. Hopefully, well, we're not sure what will happen come semester 2 of next year, but if we're still in the online format, again, your anatomy labs will also be online, all right? As it relates to your physiology lab, again, these will involve data interpretation, so you will not be doing a physical lab at all right? Do you have any questions so far? Sean, any questions?
No, there aren't any questions in the chat, no.
All right, good. So I'll go on to the next section. This involves your year 4 and year 5, which I will skip for now, as that is at least 2 years away, all right? We still have the sexual harassment policy in place, guys. If you're harassed, as we said before, you can contact the Deputy Dean of Student Success, your program director, as well as the registrar. And you can report to the Health Center for Counseling. At the end of this presentation, you will see the information for getting in touch with the Health Center online. Social media policy, guys, is still in place. Please be very, very careful as to what you post and what you say on social media. It gets around. And
Dr. Brown?
Yes.
Someone's asking for a reminder as to when summer would begin after second year.
Summer will begin in June, the latter part of June.
Okay, thank you.
The latter part of June. So please be very careful, guys, what you post on social media. Be very, very careful what you post on social media. I know sometimes persons are upset with UE regarding their policy. They might be upset with myself here or the program, but please be very, very careful because it can come back to haunt you, all right? Your foundation courses, most of you should have, well, you should complete your foundation courses by the end of year 2. I'll say that again. Please ensure that you have completed all of your foundation courses by the end of year 2. You are required to do 3 in total. The list of information regarding your foundation courses is posted in the MPDO course container on Orville. Just a refresher, most of you should have done critical reading and writing already. And then we have CaribSafe Law and Governance. Only one of these can be substituted with a modern language course. But please ensure, guys, that you complete all 3 of them in your year 2 because you cannot progress to stage 2 if you have any foundation course outstanding.
A quick question on that note, speaking of Orville, Dr. Brown. They're asking when it is that the course containers for year 2 will appear in Orville.
All right, so I have noted that it's not just year 2, it's for the entire university that students are having some issues regarding their course containers, not just only you, but also lecturers. That is a matter that has to be dealt with at the MITS level, and we'll be in contact with them to see how best I'll be in contact with them to find out exactly what is happening, because it not only affects the students, but it also affects the lecturers. And in light of the fact that everything is online, you're now realizing that it has a serious impact on your lectures. It was pointed out to them on Friday because we started getting information from students stating that they're not seeing their course containers. We were also getting information from lecturers indicating that they were not seeing the course containers either. So we'll be checking into it, and then we will get back to you as soon as possible, as soon as we know. But this is a university-wide issue, all right? It's not just the MBBS.
Okay, thank you.
Thanks for that. I'm going to touch a little on examination. You realize that the exams are online, so you have to ensure that you're fully registered, that you have paid up on your fees, following the payment plan given by exam. Last year, there was a little bit of anxiety regarding when the timetables would come out. And if you look on the exam timetables, that is, and if you look on your timetable now, you'll notice that at the very end, there are suggested dates for when you'll be having these exams. Let me emphasize that these are suggested dates and they are not set in stone. So until exam publishes their end of semester 1 final timetable, you cannot use those dates as a given. All right, I hope I'm clear. They're suggested dates. We will suggest these dates to exam, but given the fact that it's a high possibility that exams will be conducted online again, we cannot guarantee you that those dates will stand. So we'll have to follow what is posted when it is posted, all right? As it relates to the release of your examination grades, these grades have been done up and sent over to exams registry. Exams are the ones who are responsible, or the registry. They are responsible for posting these grades on SAS. It is totally out of the control of the faculty. So it's not like last year, semester 1, where you're kind of up in the air as to what was happening because there are issues with the mixed aspect of things. Everything has been sorted and sent over to exams. So it's just for them to post it to you, all right? As it relates to the administration of the exams, just for you to realize again that, I know I'm being a little previous here, but when it comes down to your end of semester exams, these exams are controlled again by exams registry. The faculty does not have any control. We set the paper and it is put up on Orville, but if you're having issues, again, you have to contact exams if you missed it. Issues, whether it be with power or internet connectivity, we have to discuss the matter with exams as well as MIPS first before we can give you an answer. Does somebody have a question, Yashawn?
Yes, I actually have one. We're supposed to have 3 lectures this morning right after this. One for digestive physiology, then cardio physio, and then digestive anatomy. But given that we don't have the course containers uploaded yet, what are we going to do as it relates to that? Are they going to be rescheduled or something else?
I will contact the lecturer. I will contact the lecturers. I'll also contact MIPS after this presentation. And then I will contact your class president to let you know what's happening.
All right, no problem.
I'll send you a link or something to the BBC. So, because these would have been conducted using BBC Blackboard Collaborate. So what we'll do, we'll contact you.
All right, thank you.
Our link can be sent to you, all right? You're welcome.
Yeah.
All right. As it relates to go-throughs, guys, I know you'll be concerned about how you'll be getting your lectures now, but I just want to get this out of the way. Go-throughs for MCQ is only granted for persons who have failed with repeat, not necessarily F, but who have been granted FWR. So persons who have been granted FWR, they're allowed to do a go-through. For persons who have already passed the course, whether it be a 50 or 51, or we cannot, based on exam regulations, there are no go-throughs for such persons. Last year, we had queries of persons who got 69 wanting to move to 70, or 74 wanting to move to 75 because of the whole GPA issue. We cannot adjust anything on the paper. Remember that your MCQ cards, your exam cards are inviolate. We cannot make any changes to them, all right? As it relates to missed exams, because this is going to come up again, you will need a medical certificate from the health center, which will be sent to the examination section and also to us. and then you'll receive a letter, and then you'll be allowed, in the case of the online exam, we may reopen at another time, but you can repeat it in June if it is a year 2 course, in August if it is a year 1 course, or December if it's a year 1 course. I suppose you were sick last year. If you're doing it during the semester, then you will not have to pay, all right? But all of this is dependent on you getting some information from the examination section. As it relates to progression, and I know some persons are a bit concerned because they're awaiting their resit exams. You cannot progress from year 1 to year 2 if you have 9 credits or more outstanding. Neither can you go from year 2 to year 3 if you have 9 credits outstanding. And as I said before, you can't move from stage 1 to stage 2 if you have any courses outstanding. All right, so persons who have courses outstanding, you probably need to be speaking to the course coordinator so they can assist you in any way possible in terms of getting through these exams at the appropriate time. If you have been unsuccessful in 3 attempts, then you'll be required to withdraw. But as we have said before to you guys in first year, you cannot appeal for a waiver, and they may allow you to do it the 4th time. But if you fail it the 4th time, then you'll be required to withdraw. So please pay very close attention, guys, to these protocols. For persons who have failed 1 or more, some of you would have been familiar with this. You will get academic counseling, and we basically put you on to the course coordinators. Many persons have taken up on this, and I'm very happy to see that they were so much more successful in semester 2, having gone through the counseling. Please make use of the PPDO officers. Please make use of the PPDO officers. It goes a far way. Please remember that you can email your course coordinators if you're having some issues with a course, and they'll be very happy to assist where possible, all right? For students who have 3 failures or more, you will have to get counseling from the program director, who is Dr. Trotman Edwards, and they will advise you. Any students, again, who cannot progress from year 1 to year 2, they will have to speak to the program director. And those going from year 2 to year 3 who cannot progress, they'll have to also speak to the program director. So she'll advise you of the path to take. As I said before.
Quick question, Dr. Brown, before we move to this next slide. I think the answer here is no, but I'll ask anyways. Someone's asking, is there a cardiovascular system repeat spotter for those who may need to repeat it?
Right. The repeat spotter will be in December. So for those persons who would have failed the cardiovascular spotter in semester 2 of year 1, you will have the repeat spotter for those individuals in December.
Hi, morning, Dr. Brown. How do you know if you failed the spotter?
You will be advised. You will be advised during the course of this semester.
Okay, thank you.
You're most welcome. All right, so for persons who failed year 1 courses, this would not apply here, no, but if you did not do it in August, then your next sit-in will be in December. But remember now, guys, you're going to be juggling all of those 4 heavy courses that you have in semester 1 with these year 1 courses. So you have to be able to manage your time well. And that is why we strongly advise students to sit the repeat exam, at least for the year 1 repeat exams, to resit it in August, so you don't have that issue coming into year 2. And as I said before, the repeat examinations for the year 2 courses are going to be in June. So what I'm trying to say here for year 2, guys, you have to be very tight in terms of controlling your time. You have to be very tight, and in some instances, you'll have to dig very, very deep, all right? Students who score less than 2, if you notice, you'll see FWR. The university had come up with this system under COVID, fail minus penalty, but this does not really apply to the MBBS program because we have always been instituting that. So when you get an FWR, there's no penalty, right? So it doesn't affect your GPA per se. However, when you do a resit, the maximum that you're going to get is a C. So you can't get more than a C. So even if you score 80, you can't get more than a C because of the fact that you're redoing the exam. These are the information for the health center. You can always take a picture of it on this page. You can WhatsApp, you can text, you can call for counseling. There's also a psychiatrist who you can email. You can also call, you can leave a message. Hope you have gotten the screenshot of this page.
Another question, Dr. Brown.
Yes.
Two questions actually. First is, what is the protocol that students should follow if they attempted to contact course coordinators but weren't successful? And is SPAN 1012, that Spanish for Medical Purposes, an accepted foundation course that can replace either Law and Gov or Caribbean Civilization?
You should be able to do it, provided that you did not do, Spanish at the CSEC or CAPE level. Then you would be able to replace it. Does that answer your question?
Yes, it does.
Right, great. So as it relates to the course coordinator, if you're trying to email a course coordinator and you're not getting a response, you can send myself or the program director an email. And then we'll see how best we can contact the course coordinator or the dean's office. And we'll see how best we can contact the course coordinator for you.
All right, thank you.
Yeah, but on that same note though, Rashawn, just to let you know that as it relates to the program director, I've gotten complaints, the email and not getting a response. Please remember that the program director deals with students from years 1 to 5. And she's getting emails from students years 1 to 5. They'll be setting up for the program director. I will send it to you where all students will just send their email to that email address, because we're bombarded with a lot. Likewise for myself, I have to deal with years 1, 2, and 3.
Okay,
So
no problem.
I try as best as possible. For myself, I try to respond at least within 24 hours. We try. And sometimes the same day, I will send you a response. You know?
Okay, so there is another question.
Yes.
And they're asking, if it is that you pass cardio overall, would you still need to repeat the spotter if it is that you failed it?
No, you won't pass cardio overall unless you have passed both components. So unless you have passed both components, then it would be seen as passing cardio overall.
All right, noted.
Have I answered the question?
Yeah, that's an answer, yes, thank you.
Dr. Brown, one question here. So what if you pass the written paper, but you fail the spotter? Do you have to do back over everything or just the spotter?
So if you pass the written paper and you fail the spotter from last semester, so the spotter would have been failed from last semester, right?
Yeah, pretty much.
So therefore you will just do the repeat of the spotter.
Oh, okay. All right, thank you.
Just remember, it is basically, it was like it's an ongoing course. So any course that starts in one semester and continues over into the next semester is basically seen as ongoing. All right, so that is why you were not given a grade for the spotter component of cardiovascular. But when you have completed the MCQ, then you will get your grade. Follow? And for those persons who have failed the spotter component, then you will do your resit in December, and then get your final grade at the end of your semester 1. With me? Yes, have I answered? Not hearing? Rashawn? Hello?
Yes, my question.
All right, remember this is online, guys. I can't know if you hear unless you talk to me, and I'm sharing screen, all right? Now your SSMs, you were given a pretty easy SSM this year. It was basically to write a reflective piece. Given the fact we will be setting up what we call a Turnitin assignment section in your class 2024 container. And it will go somebody's mic. Can you please mute your mics? Thank you. So you'll be required to upload your Turnitin assignment from September 14th to October 14th. We're giving you a month because as you can see, no person still can't access their container.
Okay, on that note, Dr. Brown, sorry to interrupt. Two questions. One is, if it is that someone has requested an override via SAS, would they still need to email the course coordinator? And the second is that if it is that you there's a stipulation that you can't fail more than 9 credits. What's the situation if it is that you failed exactly 9?
You can't go over 9. So if you fail exactly 9, you're on borderline, but you can't go over 9. They say if you fail more than 9 credits. So if you're on 9, then you're on borderline.
Right.
All right. So as it relates to the overrides, please remember, guys, overrides are granted only by the program director. So the individual to email will be Dr. Trotman Edwards. The course coordinators and the stage 1 coordinators do not grant, the stage coordinators, sorry, do not grant overrides. So matters of if you register on SAS and you require override, please email Dr. Trotman Edwards right away.
All right, thank you.
Or if it's a number of you, then I could ask yourself, Rashad, or Ms. Lindo to complete this.
Hi, Dr. Brown. I currently deal with it, yes. And for everyone that has come to me, I have told them to email either Dr. Trotman Edwards or Miss Brown.
Or Miss Brown. All right. So, but if they're emailing either, tell them to copy. So if you're emailing,
I've done that as of late as well.
Very well.
And Dr. Trotman copy Miss Brown.
Right. So they should do that. Make sure that Dr. Trotman is on that email at all times, and she will grant the overrides for you. All right. Any more questions, Rashad?
No, that was it.
That was it so far. All right. So for your SSMs, remember, we're giving you at least a month in order to upload. So at least you can sort out the payment issue. We know some of you have a lot of money that you have to pay, especially those that are on the full fee paying. I know some persons are worried because they might not be able to have, gotten back a scholarship. Others, we know it is COVID times. We know it is COVID times, and some persons, the parents might have lost jobs. It is tough. It is tough. I'm not going to pretend it is tough. And I know a lot of you are coming back in very stressed out. And some of what I'm telling you here is not helping you at all. Tell you that your second year is going to be rough. But it is what it is. And that is why we say, if you need counseling, please, please, please contact the health center or the PPDO officer. All right, but do not go it alone, because we know it is rough. We know it is rough, and it is rough on us lecturers as well, guys. It's not that we're in a bubble. All right, it's all over.
Quick question, Dr. Brown. Someone's asking if it is that they had completed the SSM hours already, but took a year off, leave of absence, would they still be required to do the essay this year?
Right, as long as, they took the SSM would have been for first year, So they should have done whatever SSM they did in the first year. That is what they should upload. Because
okay, all right.
They would have completed it in the summer, their first year, before they realized that they would have had to withdraw, right? So whatever they have completed, there are some other persons I know who did a program with Dr. Gossa Williams, and also to upload their report. For persons who probably took a leave of absence, so they completed first year, but did not do second year last year, right? So they're coming into second year now.
Yes, that's the situation.
Right, so they should have done the SSM in the summer of their first year. So whatever that report is, they can still upload it.
Okay, no problem. We have some more questions here. I think I can answer this one based on what you've said so far, because this person is speaking hypothetically. If it is that you failed the cardio spotter, but then you wound up getting 70% out of the possible 80 on the long paper, how would the grade look? Well, If it's like you fail the cardio spot, you still have to end up redoing it in December anyways, given that it's from semester 2 of last year and you'd be notified of this failure. That wouldn't impact the long paper, just that you'd need to be doing an additional spotter in conjunction with the digestive and endo spotters as well.
Yes.
At least, okay, good. So the next question, well, two more questions actually. Was the failed spotter rule in effect for year 1? And are DDS students also required to do an SSM?
The DDS are, so let me start with the DDS student. The DDS students, you normally have your separate SSM program. Started way before the MBBS students, all right? So whereas the MBBS students, they deal with their SSM programs in the summer. You would have started, if my memory serves me right, from during the semester 1 of year 1. And you have been going through. So you can discuss with Dr. Jones, your program director, as to how you will upload your SSMs. Because yours is I need to go back to the spotter. Remind me of the spotter.
Yes. If the failed spotter rule was also in effect for year 1, and there are 2 more questions after this, so I'll ask them when you answer this one.
So let me finish these first before I go to the other 2 questions.
Yes.
The failed spotter rule was in effect from year 1. I'm not sure if I fully understand.
As in, if it's a case where, in, say, for example, you did the spotter for locomotor in semester 1 and you end up failing it, would you have had to repeat that spotter?
No. All right. So all right. So as it relates to, so what I'm saying here about cardiovascular does not apply to any other course, because for locomotor,
everything was from semester 1.
Everything is from semester 1, and all the assessment was done in semester 1. So the thing is with those courses like locomotor, embryology, and histology, if you fail any component, you have failed and you fail over everything.
Okay.
As well as in the case of cardiovascular, you would have noted that you did not do a theory component. So the only component that you did was basically the spotter.
Okay.
So,
yeah, that's okay. The next, wait, it's actually 3 questions now. So the first is, do you have to pay for the cardio spotter reset?
If you're doing it during the semester, you don't have to pay for it.
Okay. The second is, would redoing the spotter result in adding 6 credits to the 9 credit limit that's required for withdrawal if it is that you fail?
No, remember that your cardiovascular course would not have been completed as yet. So nothing on the system in terms of credits as yet.
Lovely. I think that would answer this question as well, but I'll ask it nonetheless.
Right.
If it's a case wherein you wind up failing the spot and having to redo it, would you get a C at most, or are you going to get whatever grade it is that you would have earned from the long paper and the spotter reset as well?
All right, so I'm going to put a hold on that question for now, and I'm going to do further consultation with Dr. Trotman on that part.
Okay, final question. How early will students be notified if it is that they failed the cardio spotter from last semester?
The dean's office is normally responsible for notifying students, but normally students get probably midway through the semester.
Okay.
But don't although further consultation with the dean's office, as they're the one who inform the students. And
okay, no problem. Thank you.
So let me quickly go through here because we're almost out of time. This is important, guys, your vaccination, getting all your immunization shots. I know we're in COVID time now, but the good thing is that most persons are at home. So you can dig up wherever you need to dig up, wherever you need to go to find information as to whether or not you have gotten all of these shots. Remember that you were granted for the COVID, that's a different kettle of fish, as we don't have a vaccine for that. But all of these apply, including flu shots at the time that you'll be starting your junior clerkships. Now, some of you may be saying, but this is all 1 year away. What we have found that has happened in the past is that students wait until the last minute and then you're not able to start your junior clerkships because they have these outstanding. So please make sure that you start looking into it from now. Check to see how many of these you have in place. If you need to get boosters, you need to find out as soon as possible. So you can, you know, take your time and go through. I know that the clinics are kind of bombarded now with COVID cases. Persons are probably a little bit nervous about going in. I'm not saying you should do it now in semester 1, but at least start looking into it at least semester 2 and at least semester 1 of your year 3. So you're not at a disadvantage, all right? So we're gonna quickly go through your year 2 results. We have only 9 minutes, and I'll probably give 5 minutes, seeing that your next session is about to start, and I need to contact the course coordinator because you guys don't have access to your course, all right? So basic hematology, as you can see, we have a good spread. And this is not the reset, this is for your semester 2 exams. We have 7.5% of the students who will have to repeat. So this would have been their second attempt. So they'll have to be very, very careful come December, if they're going to repeat it in December, how they proceed. So I will suggest that they speak to the course coordinator before doing so. A lot of the persons were centered around here, which is not so bad. You have the B+ and the A minuses, and you have almost 10% of the class getting A's. So that is pretty good. Cell bio, I know some persons are smiling. We have never ever seen grades like this in the umpteen years of the MBBS program, where practically almost everyone got A's for the course. This is not a normal distribution. And I guess some persons really enjoyed this exam in semester 2. So congratulations to all of you who got your A's. I think basically most of the class got A's this time around. For your healthcare concepts, again, we had no failures, which is good. And we had a pretty even distribution. Most persons were centered around the B+ and the A- region. About 9.4% of the class got A. So you guys did pretty well. For neuroscience, we kind of had clusters. We had 8.5% that will have to repeat the course again. About 18% of the class, basically in the C region. We have a pretty decent spread with the B+, and we got A+ this time around. About 4% of the class got A+ for neuroscience 1. As I said, the results this year were pretty good. For respiratory system, again, I guess these grades were the best we have seen in quite a while. We actually had persons who got A+, and if you notice here, almost an equal amount, 26.6% got B+, A-, and A. Only 1.4% failed respiratory system. Remember, you can consult the course coordinator, Dr. Shetty, and he'll be able to assist you where possible if you're going to be doing over your repeat exam in December or in August, all right? We'll talk more about that in semester 2. Okay, so we're moving on. So that's basically it for IMP, guys. IMP is a pass fail, so basically everybody passed IMP. All right, guys. I'm gonna ask you again that when you're doing your exams, that integrity, remember integrity, please remember not to cheat. I know I'm not saying anybody here cheated, but the university noticed that a lot of persons, they got together in groups and they did their exams, among other things. But you know, we are professionals here, we're budding professionals. And as we had put out in your, at the beginning of each course container, we're expected to maintain academic integrity. I'm going to ask that you continue. I'm going to ask you all to continue the good work that you have been doing. I want to say a big thank you to the exec, especially Ms. Lindo and Mr. Stewart. Ms. Lindo worked really, really hard, very, very hard, guys, for you all. But please remember that you also need to read. You know, you need to read. You need to read the regulations. You need to read to see what is happening. so that you don't put too much pressure on, say, Mr. Stewart or Miss Lindo. Remember that they're students just like you. So whatever information you can get by just reading the regulations, please do so. I have put up a FMS guidance document in your course container on the MPDO platform. I'm going to ask you all to read again. All
Dr.
right.
Bright, we just a few questions. Will we have access to this presentation? Well, now that it's concluded, essentially.
You want the, I can put the PDF version of it in the MPDO course container.
Okay, no problem. Is the delivery of anatomy labs for this semester going to be asynchronous or synchronous?
All right, so here's the issue. All right, so we're gonna, I think I stopped a little bit too early in my presentation. Right. I'll just say it. Now, if you look at I know most of the MBBS students prefer to have their lectures synchronous. There was some.
Sorry, Dr. Brown, you're muffled. We're not really hearing you very well.
Muffled? Are you hearing me better now?
Yeah, that's much better.
There was some deliberation as to whether or not we'd be doing blended. I'm sure you would have heard the Ministry of Education talking about blended.
Right.
Towards the end, we had to shift to fully online. Now, what that means is that in going blended, your anatomy labs would have been face-to-face. We had to change that given the rise in COVID. What does that mean? It means that we're now in the process of trying to record all of those labs. We are very short-staffed in terms of the IT, as you would have noticed from last semester. So some of them may not be delivered synchronously. Follow? Some of them may end up missing the tutorial at the time that it should be given, but the YouTube video will be uploaded. All right? So I'm sure people will explain to you further how they're going to navigate. But whenever there has been a question in last year, and I think whenever Abby had asked, you have missed the class, etc., we were quick to give you all the information as we have it. And we have always been very, I think I've been very open with your class president in terms of where we're at. So we will, and as I said before, some of the lectures, because some of your lecturers are on the front end, and you would have heard the med students, the interns, those who are just finished complaining about how they're dropping on their feet. Because it's no different from some of the lecturers that you have lecturing on the course. So some of them may miss the slot, but we will try as best as possible to reschedule. And we'll also be trying to ensure that the content is put on Orville. But as you can see with this issue that we're having now, it may run up into a little bit of a challenge. All right?
Okay. All right, no problem. And two last questions. Are there going to be changes in the assessment formats for the exams to make the measures feasible? And is there going to be rescheduling of the lectures, or will we just receive the lecture slides once again?
We will, all right, let me start with the last one. We'll try as far as possible to reschedule the lectures. We will ask the lecturers as far as possible. We did try last year. It didn't happen in all cases. We will try as far as possible to ask them to record it on BBC, so at least you can have it there. We will try, and we'll keep trying, asking them to do so. So that it's not just a case where you just have the slides. So we'll keep on pressing. We're not successful in the call. Can you repeat the first part of that question for me, Rashawn?
The first one was, are there going to be changes in the assessment formats to make the measures feasible?
Changes in the assessment format. I'm not quite sure what they mean by changes in the assessment format. Can that person elaborate?
Is he here? Yeah, he's here. So Mr. Casanova, open your mic and speak, please.
Okay, so in terms of having the exam synchronously done. All right, so because of the fact that you are doing MCQ questions and not essays, like in other courses, for example, the rest of the university, probably what you're looking at is the fact that persons were given 24 hours in order to complete their exams, right? The fact of the matter is you're doing MCQ No other faculty conducts final exams with just MCQ questions. So that is why, as a matter of security, and this is something that has been approved across the board on all 3 campuses and by the Board of Undergraduate Studies, it has to be done synchronously. It has to be done synchronously. If it is 5 to 6, it has to be done 5 to 6. It would not make sense for us to give you 24 hours. Persons can look, see what was on the paper and share with their friends. In the case of persons who are doing essays, yes, they can access it over a 24-hour period, but they still have a limited amount of time in which to upload their essays. And the essays are put through Turnitin. So if there is cheating, if there is collusion, we can pick it up and they're penalized. But because of the fact that for the MBBS program, it is all MCQ, then it has to be done synchronously.
Okay, thank you. And the final question pertains to the flu shot. Is it that we'll have to get that on our own time, or will we be directed to get that flu shot done?
You'll have to do it in your own time, but the flu shot, you can wait until like your first semester of year 3 to deal with the flu shot. And they will advise you. So 9 o'clock and you have your lecture with Dr. Roy Green, and I'll have to quickly inform her that you guys can't access the container. So unfortunately, guys, I can sort out that issue for you before talking to the year 1s.
All right, thank you, Dr. Brown. We appreciate it.
I try to, where do we have the lecture? As I said, somebody's asking, where do you have the lecture? Again, I have to in order to send you guys a link, a guest link, so you can access. All right? So I'm going to sort that out now. All right, guys. It was good having you. All the best for your semester. Try as best as possible to answer all your questions. Thanks again, Roshan, for your help. And
no problem.
All right. Thank you.